Hello everyone, welcome to my YouTube channel. Now we're going to discuss about blood supply to the breast. These red marks are the arteries here and there. So when you are discussing about the blood supply to the breast, it is the most important high yielding anatomy. So we have three main blood supply to the breast, and also we will see its branch to the breast. So let's say this is axillary artery. We know that axillary, this is subclavian artery. Once subclavian artery passes the first rib, this is the first rib. Once it passes the first rib, it's named as axillary artery. Let's label it. Here we have axillary artery. This is axillary artery. So this axillary artery has three main important branches that give blood supply to the breast. The first one is here. Let's say this is the one of the branch of axillary artery. Here is another branch, and here there is another branch. So these three main branches from the axillary artery gives very important blood supply to the breast. So the first one here is we have superior thoracic artery. We have here superior thoracic artery. Then here we have thoracoacromial artery. Thoracoacromial artery. Then here we have lateral thoracic artery. Lateral thoracic artery. So this is the first one, as we said, superior thoracic artery. We have thoracoacromial artery and lateral thoracic artery. These three branches are the branch of axillary artery. These are very important blood supply to the breast. The other main blood supply to the breast is internal mammary artery. This red mark is internal mammary artery. Internal mammary artery. Maybe on some books you might find it as internal thoracic artery. The same, they both are the same. So internal mammary artery, it has perforating branches. Usually they are not named, but we say perforating branch of internal mammary artery. So it's posteriorly. So it's also the one of the branch of subclavian artery. We said axillary artery, it gets its name once the subclavian artery passes the first rib is named as axillary artery. But internal mammary artery or internal thoracic artery is a branch of subclavian artery. It gives perforating branches to the breast. The third and the first, as we said, the first one is axillary. The second one is internal mammary. The third one and the most important one again is a posterior perforating branch or posterior. We have perforating branch of posterior intercostal arteries. So these are the perforating branches of posterior intercostal arteries. These intercostal arteries are the arteries that usually lies behind the ribs. They give the perforating branch toward the breast. So we call them as perforating branch of posterior intercostal artery. So in short, the blood supply to heart is mainly by three basic or main branch of arteries. Those are axillary artery, internal mammary artery, and perforating branches of posterior intercostal arteries. There's a venous drainage of breast. Venous drainage. So this is not complicated thing. When we talk about venous drainage, usually venous drainage follows artery. So if you once you know the arterial supply to the breast, it's easy to remember the venous drainage. We have basically we have two main venous drainage. These are the one is superficial venous drainage, superficial, and the second one is deep venous drainage. So we have both deep and superficial venous drainage. So when we say superficial venous drainage, this is this superficial venous drainage usually drains the venous blood basically from the skin and the subcutaneous tissue. Mainly they are under skin within the subcutaneous tissue. So these are just the subcutaneous veins. This is superficial. So now I will focus on the deep venous drainage. Deep venous drainage is basically they follow the arteries. So the first one is we have a lateral thoracic vein. We have lateral. It is the same as lateral thoracic artery here. So I can write here lateral thoracic vein. So lateral thoracic vein, it is one of the venous drainage of the breast. So it drains the venous drainage from the breast. The other one is we have internal mammary artery. At the same time, we have what? Internal thoracic or internal mammary vein. So internal mammary vein. Still, it follows the same name. So if you have once, if you know the artery, you know the vein. The third one is, as we know, the third one is the perforating branch. So posterior intercostal artery, the same here. We have a perforating branch, so posterior intercostal vein. So these veins also drain the posteriorly, the same as how the artery does. The most other important thing that you need to remember is about Batson's vertebral venous plexus. This is very high yield. So this Batson's vertebral venous plexus is very important venous drainage you need to remember, because most of the time this when if a patient has, or if someone has breast cancer, usually they metastasize to skull, vertebral bone, and the pelvis through this Batson's venous plexus. So if you remember Baton's venous plexus, it's very important that you need to remember the question. Usually they ask you, how do the breast cancer can metastasize to the vertebrae or spine? So the answer is through the Batson's vertebral venous plexus. Great. Now I will give you a mnemonic so that you can easily remember the blood supply to the breast. So the mnemonic says BALTI, which means bucket. So B stands for branch from the posterior. It stands for branch from posterior intercostal artery. So B stands for branch from posterior intercostal artery. A stands for acromiothoracic artery. Acromiothoracic artery. L stands for lateral thoracic artery. T stands for superior thoracic artery. I stands for internal mammary or thoracic branch. So just by this mnemonic, you can easily remember the blood supply to the breast. So as we know, this acromothoracic artery, lateral thoracic artery, and the superior thoracic artery, three of them are the branch of axillary artery. But these branches are from the posterior intercostal arteries, and internal thoracic artery is it's a branch of subclavian artery. Thank you very much. Have a good day.
Surgical Insights with Dr. Estifanos. Join our YouTube channel for more.